Hello. Today I'm going to talk about deformities in elderly. See, we have seen a lot of elderly with various kinds of deformities. So mostly these deformities are related to arthritis. Okay. So arthritis can be autoimmune or overuse or disuse. Okay. So when I refer to autoimmune or conditions like rheumatoid arthritis, where there is joint involvement, swelling of the joint, and then the joint becomes deformed. So you would have seen plenty of elderly with the fingers bent and toes bent and all that. Yeah. So this kind of arthritis is related to autoimmune problems. Okay. But there is the other arthritis related to overuse. Okay. Overuse is when you they have a tendency to overuse a joint. Like, for example, females with the pain in the shoulder or elbow, or athletes who have, overuse of the elbow joint, and then they develop arthritis of that particular joint. And this all this associated with the other problem of disuse atrophy, which is very, very common in elderly. So as you see patients in the elder age group, they have this problem of uh, stroke or something, like they start having inability to move, kind of, they don't want to actively move, or they don't want to actively uh, get engaged in anything. So at that time, what happens is there is a problem with the muscle wastage. The muscle wastage will eventually cause the joint also to get fixed. So sometimes you find elderly with malnutrition where they have already landed up in fixed flexion deformities of the joints. Okay. Similarly, it starts as a small periarthritis of the joint, but later gets involved with the joint, and finally, the movement slows down, and the joint starts getting fixed. So this is when the elderly find out that they're not completely able to move the joint. So, but here, physiotherapy alone will definitely not help. Exercises, and sometimes we may land up even surgeries to release the muscles or the ligaments around the joint. So this is quite difficult in elderly. So prevention of these deformities, prevention of these immobilities, and prevention of this fixation of joints is very vital when handling elderly. Thank you.